Hello, friends. I'm excited to present another inspiring journey. Before getting into the episode, I would like to thank everyone out there for supporting Nurtured Dreams by liking, sharing, and subscribing to our channel. If you like our content, please leave your valuable comments. Our guest for today is a renowned neurosurgeon trained at the premier Neuroscience Institute in Bengaluru. He has been honored with the Silver Jubilee Award for Best Outgoing Neurosurgeon by the Health Minister of the Government of India. He is also a certified yoga therapist from Yesvyasa, believing in a holistic approach to treating various diseases. In conversation with Dr. Mayur Kaku, a yogic neurosurgeon. Namaste, Mayur sir. Thank you for
Namaste,
accepting
how are you?
very good, sir. Very good. Thank you. How are
Yeah,
you?
I am also good. Please, I am very happy to come here on your YouTube channel. I have been following your YouTube channel, and I am very much impressed with the work you are doing, bringing people together, and they are all sharing amazing work experience of theirs in the society, and I am very happy, motivated because of that, and that is how I was very happy to come to your channel also.
Thank you very much. And such motivational words from you. And it means really a lot, sir. Thank you very much.
Thank you.
So please tell us, you have achieved quite an you've had an excellent academic career, and you achieved a gold medal for your academic excellence. Can you just tell
Yes.
us what was your feeling when you achieved it?
Okay, great. So before that, I will go slightly backwards about how I became a doctor, MBBS, and then after that MCH neurosurgery. This gold medal I got was for MCH neurosurgery. So MBBS was from Government Medical College Yavatmal, and being a government medical college, a lot of work will be there, and along with that, lot of experiences we will have. And based on those experiences, I decided that I will be doing my further education in Institute of National Importance, like AIMS, like PGI Chandigarh, or like NIMHANS, or in South like Zipmar or CMC Vellore, like that. The reason being, institutes of national importance, they work at international level. Their knowledge fund and their training fund is amazing. So that was the reason. And after that, when I joined, it's not easy because only 3 seats are available. In NIMHANS, only 3 seats are available. Out of that, I got second rank in third attempt. In first attempt, I did not get anything. Second attempt, I got seventh rank. And then in third attempt, I got second rank. So after that, there is another journey of 5 years to become the neurosurgeon. And in that, a lot of hard work, a lot of dedication is required. And we do thousands of surgeries during training itself. Along with that, we have to show high level of work ethics, high level of integrity. And on the basis of that, we get awarded with gold medal. So I never, actually, honestly speaking, I never thought of getting a gold medal. What was in my mind is that I have to just work, you know, in the honest possible manner. I should enjoy my work. I used to enjoy my work, and I used to continue to work. And that ultimately paid off. Many people, you might not be knowing about this, but in NIMHANS, it is not decided by just one person that this person will get the gold medal. There will be feedback given by the nursing staff, there will be feedback given by the OT staff, there will be feedback given by the patients. And based on that, plus your academic performance, all these things combined together, you will get the Academic Excellence Award. So what feedback I got was that I come very early in the morning, and behind the back of professors also I was working. It was not like that in front of professors I am working, and behind their back I am not working. So all these feedbacks are given by basically by nursing staff and the OT staff, and they tell the professors about how this person was conducting himself or herself. So what message I want to convey is gold medal should not be pursued by just showing off yourself in front of the people who are concerned or people who are in power, but you should be doing good to the normal public who does not, according to general norms, does not decide anything about your academic excellence. So I was good with my security guards, I was good with my nursing staff, I was good with my OT staff, I was good with my patients. All these things, they paid off, and that is how one should achieve overall 360-degree excellence rather than trying to impress in one line. Yes, yeah.
But what did you feel when you were awarded with that?
Honestly speaking, I did not feel anything special.
Okay.
Because
You never aspired for it. You
with
never
every
aspired.
milestone, with every milestone, your responsibility increases. You go one step up, and you have to be consistent. The biggest reason for failure of people is success itself. You can think about it, that once a person tastes success, they become arrogant and they become complacent and think that they have achieved the world, and story stops there. So for me, it was just a milestone, and from there onwards, it was my independent journey which had to be pursued. So this happened in 2016, and now it is 7 years post MCH. I am a senior consultant now, and in addition to that, there are so many aspects which I had to cover, and I was covering. I am covering, and I will continue to cover. So that is what means the feeling, special feeling. Generally, to a to a person who wants to consistently perform, it generally does not come. It may be a, yeah, definitely I felt happy, but honestly, apart from that, there was nothing, euphoria kind of phenomenon was not there.
When did you feel that you need to club the yoga and your medical treatment in
Okay.
while treating patients?
Yes, the in one of my lectures, I have spoken about this in detail. My own teacher came to me for spine surgery. Okay, and he told that you are in Bangalore. I want to get surgery done, and why don't you help me out and all these things. Then at the same time, I was seeing, because Nimhans is a very huge institute, people from all across India were coming, and specifically for spine surgery. Uh, the problem was that even if you do one time, two time, three time, there is always fourth and fifth time also surgery to be performed many a number of times. Okay, because there is something called as adjacent segment disease. Like if you operate at L4, L5 level, after few years, the L3, L4 and L5, S1 levels also they get damaged because of instability which is created. And that is how I was seeing that even though most famous neurosurgeons have performed surgery, the people were suffering. And I am a practitioner of yoga since childhood. I thought that this can be prevented. I have seen in my childhood my grandmother, my grandfather, my father performing yoga and having a healthy life. And in addition to that, my grandmother used to treat people with back pain and neck in a very holistic manner. She was not a doctor, but through these various practices of yoga, she used to treat them. So I thought, why not? And then my teacher, I told, sir, you don't undergo surgery. I will teach you yoga, and we will see. So at that time, he was around 72 years old, and now he is almost 80 years old, and he did not require surgery. He was advised surgery, but now he is okay, and he roams around the country. Not only country, he has his grandchildren in US, children and grandchildren in US. He spends 6 months there and 6 months here. So you can just imagine that he is leading a healthy life even at around 80 years of age without any problem. So this is the power of yoga, which I already knew, which I started implementing with my teacher. And then from there onwards, it became a trend. Many of my friends, many of my colleagues, many of my patients started rolling and rolling and rolling. And that is how I ended up finally doing a yoga instructor course, because the corporate hospitals, they ask you whether you have a degree or not. Why are you treating patients with yoga if you don't have a degree. Then that is where I pursued my yoga instructor course, and from there I did my post graduation in yoga therapy, and then I used to come and teach you people also at Suyoga. So that is the journey, and that journey has continued. And I was invited recently to IIT Mumbai also. I was invited at Alwas Foundation. So many, around more than 200 public lectures have been given. And now also, next week I am invited to JSS Mysore for one lecture on human body, the ultimate machine. So this is the journey of yoga, and definitely one should understand what is the suffering, and is there a simpler alternative available. If simpler alternative is available, then why should we pose patient for surgery or pose patients for invasive procedures? It is possible. So if it is possible, one should pursue it. Yeah.
So during COVID, you started with Brahmamuhurta Yoga.
Okay.
What was the inspiration to start, and
Okay.
how did it
So
become the way it is today?
okay. So the thing is that my frequency of public appearance increased before Corona a lot, and I was every week, every Sunday, I was at different place, continuing to give lectures on various topics of yoga. Yeah, I used to even come every Saturday, I think, to yoga also before Corona. And what happened is that when Corona came, people started asking, "Sir, what next?" So I told, okay, let us do a YouTube live stream. So that was my first YouTube live stream, my YouTube channel called Mayur Kaku. And from that day onwards, we continued. We kept on continuing. And it was on like 6 to 7 a.m. in the morning. And we were continuing. There was in between some disturbance in the form of like people tell that why are you speaking English? Why don't you speak Hindi? And that is where I started speaking 5 languages: English, Hindi, Kannada, and Marathi and Gujarati. 5 languages I started streaming every day, one language. That is what we did. We have videos in 5 languages. And then one fine day, what happened is that one of my patients, he had a brain tumor, specifically glioblastoma, and he was just 34 years old. And he asked me, "Sir, I don't drink, I don't smoke, I don't have any bad habits. Then I'm a vegetarian. Then why did I get cancer?" My simplest answer is there is one of my lectures called Neuroscience of Cancer and Immortality. You can go and check it out. But my simplest answer is that even newborn babies get cancer. So cancer is basically a normal process to everybody. Even at this moment, I mean, my body and your body also, there are cancer cells. But they are daily, routinely removed from the body through the immunity. Okay, and that immunity is maintained through various good practices. That is good brahmacharya, good dinacharya. All these things, they help to remain healthy. Okay, and this I asked him, "What is your dinacharya?" And I came to know that he is working for US based company in India. So he is sleeping in the day and working in the night. And that is where I will share some of the slides with you. I will show you the slides, and you can see them. I have given a lecture also on this: can lack of sleep cause cancer? And you can see, and you will come to know that this melatonin. There is a hormone called melatonin, and that hormone is secreted only if we are maintaining our synchrony with Suryodaya and Suryastha. There is one Sanskrit shlok from one book called as Ashtanga Hridayam, which was written somewhere around 800 years back. And it says that Brahma Muhurta Uttishte Swasthya Rakshartham Ayushindayata. Means somebody who is waking up in Brahma Muhurtam, that is 96 minutes before sunrise, their Swasthya Raksha also will happen, health protection also will happen, and Ayushya Raksha also will happen. Means their Ayushya means lifespan. So unfortunately, modern medicine talks about only health, very rarely and very less about longevity. And that already, without any technology, our ancestors knew that it is very, very important to maintain dinacharya, to maintain synchrony with Suryodaya and Suryasta. So that is the point which I realized. I gave a lecture on that. Then I thought, why only lecture? Why not implement in my own life? And that is where my 6 to 7 classes were shifted from 6 to 7 to 4:30 to 5:30. So initially everybody laughed at me saying that what are you doing? It's nobody is going to come at 4:30 in the morning. I told only 2 people come. That is also fine. I don't mind it. And now we have more than 122 people joining Brahmamurti Yoga. And our sankalpa is at least to invoke 1 crore people into Brahmamurti Yoga, because we need a conscious population, really conscious population. And through that, we intend to reap Maharshi effect. The Maharshi effect is something where when we meditate together, all of us, when we meditate together, we change the vibrations around us. And if more people meditate together, the magnitude or the amplitude of the vibrations, they are going to be very, very strong. And even if somebody has negative tendencies, these vibrations will shake off their negative tendencies. The criminal nature of mind will go away. The selfish nature of mind will go away. And all these things is possible only through practicing Brahma Muhurta Yoga and collective consciousness meditation. I hope I could give you some insight about Brahma Muhurta Yoga. And I invite you to Brahma Muhurta Yoga. You can also join, and you can also be a part of this collective consciousness journey.
Definitely, sir. Thank you. So tell us about your trust, YENRI Trust, and what is its roadmap?
So YENRI is a Kannada word. YENRI, yen ಮಾಡ್ತಾ ಇದ್ರಿ? That is the Kannada word, and it means that kya re kya kar raha hai in Hindi. Correct? So if somebody is doing some mistake, we ask, no, what are you doing? Correct? Same is YENRI. YENRI is a question to humanity. It involves the approach through yoga, that is Y, E for environment, N for neuroscience, R for research, and I for institute. So through the practice of yoga, most of our mistakes as human beings can be corrected. Our all mistakes as human beings, whatever we do in selfish manner, can be corrected. And in the same selfish manner, we have actually damaged the environment in which we are living. So environmental science is very, very important. All of us need to have intense knowledge about environmental science. And all these things, whatever science is there, yoga is there, all these things basically are working around our nervous system. And our neuroscience also, we have to understand what is our brain, how it works, what is mind, what is consciousness, what is spinal cord, how all these things are interconnected, how health is affected through various disturbed, stressed mindsets. So all these things we are trying to study and propagate in a positive manner to the society. And that is what is YENRI Trust. It was born when I was on the journey to keep on giving lectures before Corona every Sunday. And in that one fine moment that came into my mind, and then this was born, YENRI. It's going on. We teach Bhagavad Gita, we teach Patanjali Yoga Sutra, we teach various scriptures, including the Ashtanga Hridaya, so on and so forth, so that people understand basic our scriptures, and through that they can live healthy life at no cost, at minimal cost, like that.
All the best for your work, sir. Very glad to know.
Thank you very much.
What are the do's and don'ts for mental health?
Okay, so like do's and don'ts, when you speak like that, I get reminded of Ashtanga Yoga, which was described by Maharishi Patanjali. And if you I think you know it, yam, niyam, asana, pranayam, pratyahar, dharana, dhyana, and samadhi. The path of yoga, the life of yoga, helps us to make out these do's and don'ts. So yam is like ahimsa, satya, asteya, brahmacharya, aparigraha. So it tells us what not to do. So don't do hinsa, is ahimsa. Is satyam. Asteya. Don't steal things. Asteya. Brahmacharya. Don't indulge into sensual pleasures. Brahmacharya. Don't hold things. Aparigraha. Like that. So these are don'ts. Now do's. Keep yourself clean. Shaucha. Keep yourself content. Santosha. Keep yourself busy and keep yourself into tight practice. That is tapas. Keep doing self-study. That is swadhyaya. And keep bowing down to the supreme consciousness. That is Ishvara Pranidhana. So mental health also is taken care by yoga. Okay, but we generally we don't think in that manner. We are just, and you just imagine, just think about it, that if we don't become one, and then all these phenomena, do's and don'ts are to be done at three levels. Kaya means body, vacha means speech, and manasa means at mind level. Now, suppose even if I am speaking to you, I am smiling at you, but in my mind I am thinking, it means I am creating a negative mindset about you, then it is fake. That is where Kaya, Vacha, and Manasa, all the three have to come in synchrony. That is where we will be able to bring those yamas and niyamas into practice correctly. Okay? And then for our mental health, the asanas are also important. The body moves, the mind also moves. So with body movements, we can master the mind also. That is where poses and all these things are very beautifully, affecting the mind, body-mind complex, which we call it as breathing, pranayama. Breathing awareness leads to mind control. Then next is pratyahara, so withdrawing from the senses. So 80% of our information is going through eyes. We get distracted. Suppose I see a car key, here car key is there. Now, so this car key will remind me of my car, and then I may think, oh, my car had got accident done, there is a dent in my car, or else I will go, I have just a small sedan car, I want a luxury. So you see, the senses, they take us to a ride in our mind. It can wander anywhere depending upon whatever desires which we have. So that is where pratyahara is important. Fifth stage of yoga, fifth limb of yoga. Then dharana. Dharana means focusing, holding on to one point, concentration. And then that concentration also, as a human being, too much of concentration, we know that many people get stressed out. So that is where Maharshi Patanjali told, no, go to next step. That is dhyana. Dhyana means effortless practice. So whatever you are doing, you enjoy it. You don't focus so much that you start shaking and you start agitating. You do it in a very gentle manner. That is dhyana. And you reach to a stage where dhyana is also not required. Effortlessness becomes selflessness. That is samadhi. So you forget about your own self also. Many people who are effortless, but still they have, oh, I am Dr. Mayur. I have done this. I am doing this. I have such a great work done. So that I goes. When this I goes, we reach to samadhi. And as you see, this I is one of the greatest reasons for all of us to suffer. Correct? So as you see, Ashtanga Yoga has taken care of complete mental health. And if we really implement this in our daily life, we will be definitely out of our mental health problems. And I wish all of you the best to achieve the stage of yoga through Ashtanga Yoga, which was described by Maharshi Patanjali thousands of years back.
I hope our viewers have got some brief about the importance of yoga in their daily life, in our lives. Thank you, for sharing your knowledge.
Thank you. Thank you very much, Subhashri, and I wish you the best. And let us continue to do good work, and let us keep in touch. Thank you. Thank you.